Hello, everyone, and thank you for tuning in to this week's Tiger Talk, only on 91.1 KLSU. I am Mackenzie Holderbein.
And I'm Anna Catherine Slayton, and today we have the pleasure of being joined by LSU's Dr. Mark Mitchell.
How are you doing today?
Doing terrific, thank you.
That is
Glad to be here.
That is so good to hear. So to jump straight into questions, Dr. Mitchell, what is your role at LSU?
Well, I am a professor of wildlife medicine and epidemiology, and so I kind of have dual roles. One is to be a clinician, in which I direct the Wildlife Hospital of Louisiana, and the other is as an epidemiologist and a scholar. I do a lot of research on conservation medicine, trying to protect the animals of the world.
That's so cool. What prop did you bring with you today?
I brought a Jacob's chuck, and this is a structure that we use to repair birds. Basically, and they use this in human medicine as well, in the olden days especially, but a pin can be placed in here, and then basically this is a driver to place those pins, and so this is a brand new one, but we've used these to fix fractures on bald eagles and all kinds of birds, mammals, and reptiles.
That's so cool. Wow, okay. What does a typical day look like for you?
A typical day for me is I usually roll in around 6 a.m. I usually spend a couple hours trying to get ahead of some of my scholarship. I have graduate students, and they're working on different projects. And then, depending on what the day is, I get to teach one of my favorite things, biostatistics. I'm sure that's right up there for most people. And then we go into rounds when I'm on clinic. So I'll meet with all the veterinary students, and we'll discuss all the cases in our hospital and make a plan for the day, and then we spend the rest of the day trying to fix things that have been broken and presented to us.
Got you. Okay. Why did you choose this field?
Since I was 7 years old, I wanted to be a veterinarian, and I was always fascinated with all creatures in the animal kingdom, and so I was always the one who wanted to do these things. I was the kid who was out catching everything he could, and I've just basically gone from doing it in the backyard to places like Belize and Costa Rica and the Galapagos.
That's so awesome. So you get to travel a lot?
Yeah.
Got you. All right. What is wildlife epidemiology?
That is looking at population health, and it's really for those who are interested in the concept of One Health, which is looking at how the environment and human health and animal health intersect. Wildlife epidemiology is very important because what it allows us to do is to basically help protect and conserve animal populations while also looking for specific diseases in them. In the past year, for example, we've identified some diseases that potentially are zoonotic, meaning they can go from animals to humans, or even animals to animals. And it's the idea that by sharing that information, we can help protect the public. There was an outbreak in West Nile virus last summer, a little bit higher than it's been recently. We had crows, which are one of the most susceptible species, being presented to us. We were able to diagnose that, share that information with public health, and they were able to increase mosquito spraying, et cetera, to help protect the people of that area.
Got you. So how is that important for Louisiana specifically?
For Louisiana specifically, it's because we are sitting in the subtropics, and so we have a number of diseases that can stay here year-round as a result. And so being able to look at what's happening in the movement of diseases can be really key to, again, my interests are protecting the animals, but also protecting the humans. So I get to have a dual role that way.
Got you. Okay. And then does flooding and hurricanes affect the spread of diseases?
Absolutely. And so certain diseases are going to be spread much more likely with flooding, for example, because when we talk about the mosquito-borne diseases, and we worry about West Nile virus, for example, there's other diseases that we're worried about emerging as well, some of the trypanosome diseases, the Chagas disease, and things that historically have not really been here. But with climate change, that's another big issue we're facing. Climate change is affecting the way that animals move, and it's also affecting the way that diseases move. One great example is when I was, this was last century, a long time ago, when I was working on my master's degree, we were looking at parasites in raccoons in Illinois. That's where I'm from. And this is a very common parasite, and it's a parasite that when it gets into a non-raccoon host, it has a predilection for the eye and the brain. And when I came here, right before Hurricane Katrina, there was the first case reported in a human, and it was a 12-year-old child around the city park area. They had never been outside of that area. So it was starting to tell us that there was movement of this disease. I was supposed to go trap raccoons to help prove that the disease was there. And then this little thing called Hurricane Katrina came and basically knocked everything out. But several years later, they confirmed it. Well, last year, we actually identified a squirrel that came in with neurologic disease. And when we actually had a necropsy, which is the equivalent of a human autopsy, it had Balis ascaris. So a disease that historically was never in Louisiana is now here. And by looking for those things, we can make sure people are aware. Don't allow raccoons to kind of get close to your house. Don't feed wild raccoons because they'll just be attracted, and then they like to make latrines, which exposes you potentially to disease or even your domestic pets.
That's so interesting. It's nice that you're able to give out that information for local residents and stuff like that.
Yeah, and to build off the conversation of West Nile virus, Louisiana's bayous and wetlands are full of mosquitoes. So how do zoologists like yourself manage mosquito-related incidents?
Well, a lot of times with mosquitoes, as far as most cases, it's something that we can't really do a lot with, but we expect, again, certain diseases to circulate at higher levels based on flooding and what's happening. In most cases, the mosquitoes are being managed in places like Louisiana, which was foreign to me coming from Illinois, where we had mosquitoes, but we didn't have mosquito abatement. Here, of course, most people are aware that their parishes have abatement, so they go out and they spray, and they remind people to empty containers in your backyard to minimize because the risk of disease does increase. People who are going to be closer to bayous and spillways, because of the way the water moves, there's going to be certain times of the year, and they'll know it because the mosquitoes will be biting more, that there's an increased risk. And those are important times for those individuals to protect themselves, long sleeve clothing, protective netting if they're really working outside to keep the mosquitoes away, appropriate sprays, or to just stay inside where the air conditioning is.
Okay, yes. And we know that diseases in livestock can affect humans, but how about these diseases in wildlife? How are they impacting humans?
The diseases in wildlife can impact humans a couple different ways. So one is they can impact humans directly because there are certain diseases like rabies, for example, which is fortunately really quite rare at this point, but that's a direct exposure to humans. Others can be indirect because some birds, for example, can harbor the West Nile virus we were talking about. The mosquito bites the bird who's infected with the virus and then bites the human and then basically transmits the disease. And again, the human is not really going to know those things are happening other than, oh, I got bit by another mosquito. And for most people, they're going to be able to withstand an exposure like that. But, certain populations, those who might be very young or very old or with certain diseases are more susceptible. And another thing that we're starting to see is I'm sitting around young people at this table, even younger people are being found to be more likely to be susceptible to diseases that historically you weren't. And that may be due to so many different environmental factors and other things that are affecting us. But we should all take the precautions to minimize our risks.
So building off of that, which wildlife-borne diseases are most likely to impact Louisiana residents?
The biggest ones that get talked about down here end up being the viral diseases, and West Nile virus is a big one, Eastern equine encephalitis. These are mostly bird-borne diseases. And then, of course, the real big one right now is highly pathogenic avian influenza. That is a disease that you're hearing about, and even if you haven't heard about it, you know about it because over the last couple of years, when you said, why are my eggs so expensive? That's why, because of HPAI. And it is a virus that circulates in birds, and there are lots of different types of avian influenzas, but certain ones are more pathogenic, and they're highly fatal to the birds. And if they get into the poultry industry, which is the big concern, they have to cull those birds, and so they have culled or euthanized hundreds of millions of birds, which affects eggs and chicken prices, et cetera. The wild birds are the ones who can carry it. So actually, we pre-screen every bird that comes to the wildlife hospital. The students, the doctors gown up, go out, meet the citizen who brings us the bird, and then we do an exam before we bring them back so that we don't introduce this disease. Fortunately, we've only seen about 6 positive birds, but Louisiana is also the only place where there's been a fatality. So last year there was a death in the southwest part of the state. And so that risk is real. And when people ask me about these diseases, we had that recent experience with SARS-CoV-2. And as an epidemiologist, I study population health, and I would always ask the students year after year, where are all the pandemics? We don't have barriers. We can fly anywhere. We can travel anywhere. So we're exposing ourselves to things that we historically haven't. Well, SARS-CoV-2 taught us something. Avian influenza is a different type of virus, and so I want people to realize just because we have a pandemic like SARS-CoV-2, which was devastating at many levels, other viruses like the avian influenzas can actually be even more catastrophic. If we look at those diseases back into the 1918 flu, you're talking about tens of 30 and 40 million people, talking huge amounts of deaths. So we want to minimize those risks.
Gotcha. Well, I was totally unaware that the bird flu was driving up the price of eggs, so learned something new. We can't exactly control that, but what can residents do to protect themselves from these diseases?
It's a great question. The big thing to do is to minimize your contact. So always look at wildlife from afar. That's the most important thing, and enjoy what wildlife do, and recognize wildlife are so important to our environments. A lot of people say, oh, there's bats, I don't want bats around. Bats can eat their weight tenfold in mosquitoes. So I want bats around because if they're eating those mosquitoes, that means they're also potentially eating those diseases as well. And we want to make sure that we protect and conserve. So there are folks who will build bat houses, for example, or different bird houses, purple martin houses, for example, to engage the wildlife but to keep them at a safe distance. The other thing is to make sure that your surrounding area is clean and free of standing water when we talked about the flooding. Make sure we're not providing our domestic pets an opportunity to interface with wildlife. And as a wildlife veterinarian, and the fact that a good number of our cases come in because of cat attacks, and the second biggest killer of animals in the world beyond the human being is the cat, because the domestic cat has become feral, and they are estimated to kill 1 to 5 billion wildlife cases a year. They can really affect populations. So I tell folks, keep your cats indoors. They're not really built for Louisiana to be out there, and they can negatively impact our wildlife.
My cat is a fighter, so she might have something to do with that. But hopping back to the pandemic discussion, how did the COVID-19 outbreak affect wildlife and their ecosystems?
Well, as far as what happened with SARS-CoV-2 and the wildlife, there's been some studies being done in deer, for example, showing that they can harbor the virus. A lot of the work with regards to SARS-CoV-2 on the wildlife side is showing that animals can have it and potentially be carriers, but they're not big concerns for most of us. There are real big concerns with dogs and cats, obviously, because, as I've been talking, if we have the human and the animals and the wildlife, our domestic pets are the things closest to us. We want to minimize our risks through being exposed to them. Fortunately, they're not at great risk, but even they can actually develop some of these diseases.
Interesting. So what is one policy or legislation that lawmakers should enact in order to benefit the health of wildlife?
Oh, that's a great question. What should they enact? Well, I think as we start to look at how we could potentially protect wildlife, it is making sure we're saving habitat. The most important thing for wildlife across the globe is saving habitat. One of my graduate students, Dr. Graciela Aguilar, just defended her PhD a week ago. She's from Costa Rica, and she has a passion for conservation work, and the species she worked with is the lemur tree frog, which is critically endangered. And the challenges that frog are seeing, that 80 to 90% declines in that frog, and they're only historically found through Costa Rica, Panama. And, we're getting so close to 100% that that's a concern. Habitat protection is so key. It's the same in Louisiana. As we start to see more and more area, you see big discussions about construction and data centers, and we're going to grow and evolve as human beings. But while we're doing that, we have to be conscientious of what we're doing. We can get into a battle where you're going to have one side that says we absolutely don't need those things, and the other side that says we absolutely do. We need to find ourselves as centrists to say, how do we best protect the wildlife and the humans? If the wildlife and the animals go, so go the humans. And so it's essential that we protect those things. And as I'm sitting here again with this young group of individuals here, it's not my lifetime we're talking about, but when we estimate out to 2050 and beyond, we're talking about some significant declines in a lot of species. It is your cohort, I'm going to use an epi term, your cohort, your age group, my kids' age group that we're really most concerned about.
Yeah, that's such a great answer. It's so important to recognize that we all coexist with wildlife and animals. Well, that is all we have. Is there anything else that you want our audience to know?
No, if you have any questions, you encounter an injured wildlife case, the Wildlife Hospital of Louisiana can receive those cases between 8 a.m. and 8 p.m. 7 days a week. We can only take certain species at this point. Our wildlife hospital is a whopping 350 square feet, so we do take all birds. For mammals, we are somewhat limited. We can take opossums and squirrels and rabbits and certain other species, but we can't take some of the other carnivores because of the disease. And we also can take non-venomous reptiles. And anyone ever has a question or a concern, feel free to call us at the small animal clinic at the vet school.
Well,
Awesome.
Thank you, Dr. Mitchell, for your expertise, and thank you all for tuning into Tiger Talk. I am Mackenzie Holderbein.
And I'm Anna Catherine Slayton.
See you next time. Bye.